delivering the world to your doorstep. From breaking news to in-depth features, from politics to culture, from science to sports. Welcome to SNN Primetime News with Kennedy Lucas Patterson.
Welcome to SNN Primetime News, your source for the latest updates, breaking stories, and in-depth coverage of events shaping our world. The Food and Drug Administration on Tuesday approved a drug from Merck designed to treat a progressive and life-threatening lung condition in a win for both the drug maker and for patients suffering from the rare disease. The agency greenlighted the therapy, which will be marketed as Winrevair, for adults with pulmonary arterial hypertension. The decision is a big step for the roughly 40,000 people in the U.S. living with that disease because Winrevair is the first drug to target the root cause of the condition. Other available medicines only help manage symptoms. The condition refers to when the small blood vessels in the lungs narrow. That leads to high blood pressure in the arteries that carry blood from the heart to the lungs, which can damage the heart and result in limited physical activity. Starting from diagnosis, the mortality rate of patients is 43% by 5 years, according to Merck. Merck estimates that Winrevair will be available in select specialty pharmacies in the U.S. by the end of April, according to a company release. The drug is an injection administered every 3 weeks and is distributed in single vial or double vial kits. It will be priced at $14,000 per vial before insurance, a Merck spokesperson said in a statement. But the company has a program that offers eligible patients help with out-of-pocket costs and co-pays. Winrevair is meant to be used along with existing therapies for the condition to increase exercise capacity, lessen the severity of PAH and reduce the risk of the disease worsening. The approval is critical for Merck, which is working to diversify its revenue stream as its top-selling cancer immunotherapy Keytruda approaches a loss of market exclusivity in 2028. In a note this month, J.P. Morgan analyst Chris Schott estimated that Winrevair would reach worldwide annual sales of around $5 billion by 2030 and emerge as one of Merck's largest growth drivers. Merck Chief Medical Officer Eliav Barr told CNBC that, "This is a really great opportunity for the company, but really, more importantly, a great important opportunity for patients." He noted that the drug will be a paradigm shift for patients living with PAH. The company gained the rights to Winrevair through its $11.5 billion acquisition of Acceleron Pharma in 2021. At the time, Merck estimated that PAH would be a roughly $7.5 billion market by 2026. The FDA's approval is based on data from a late-stage trial, which followed more than 300 patients at a moderate stage of PAH who were already taking another medication for the blood vessel condition. The study found that Winrevair combined with an existing therapy helped patients with the condition walk about 40.8 meters more in 6 minutes than those who received a placebo, 24 weeks into the trial. There is tremendous improvement in people's ability to exercise and move around, Barr said. Because this disease causes people to be very, very homebound. They have shortness of breath, they can't move. Winrevair on top of an existing medication also significantly improved 8 of 9 secondary goals in the study. That includes reducing the risk of death or worsening of the condition by 84% compared to an existing drug alone. Severe and serious adverse events were less common in the group of patients who took Winrevair compared to those who received a placebo, according to the trial. Side effects that occurred more frequently included nosebleeds, headaches and rashes, among others. One notable advantage of Winrevair is that patients or caregivers can inject it under the skin with appropriate training from a healthcare provider. Meanwhile, some existing treatments for PAH must be administered by medical professionals at an infusion center. One of the things we heard very loud and very clear, from both patients and physicians, is that they wanted something that you could get at home, Barr said. Merck is continuing to study Winrevair in other Phase 2 and Phase 3 trials. Those trials include late-stage studies on patients with more advanced PAH disease, and those who are within the first year after diagnosis. Merck has said it expects those trials to finish around 2025 and 2026.
More news at this hour. Ford sees opportunity for Mustang as competitors abandon V8 engines. Ford Motor sees opportunity to grow Mustang sales as it becomes the last American muscle car with a traditional V8 engine, playing to generations of gearheads who've been drawn to the performance vehicles. The optimism comes after Mustang's closest American competitors ended production of their muscle cars in December. General Motors stopped producing the Chevrolet Camaro, and Stellantis ended production of its Dodge Challenger V8 ahead of a new all-electric muscle car later this year, followed by gas-powered models with twin-turbo, inline-six engines that are expected in 2025. Their exodus, and that of others in the muscle car market, is the result of changing consumer demand away from two-door cars, as well as tightening fuel economy standards and the emergence of all-electric vehicles capable of unrivaled acceleration. Jeff Morentik, general manager of Ford Blue Products, which includes the Mustang, said the pony car remains good business for the automaker both domestically and internationally. Mustang marks its 60th anniversary on April 17th. We're excited to continue to offer Mustang. It's sad to see competition leaving, but that's beneficial to us, Morentik told CNBC. For people who are looking for a true American sports car, it's available to them. We're looking and talking about the future of Mustang and how far we can grow it. Morentik declined to discuss specific sales expectations for the vehicle, but noted the company has added a new V8 model for the 7th-generation vehicle called the Dark Horse, a not-so-subtle reference to Ford's ambitions for the V8-powered car. Both the 2024 Dark Horse and Mustang GT are powered by a 5.0-liter V8 engine, with the new model generating up to 500 horsepower and 418 foot-pounds of torque. Ford also has announced a 2025 Mustang GTD with a supercharged 5.2-liter V8 engine that's expected to arrive as early as later this year, with more than 800 horsepower. Ford has been able to continue to sell Mustang V8 models in part because it has invested in making the vehicles more efficient, and it was early to adopt smaller, turbocharged four-cylinder engines that now make up about 48% of Mustang sales in the U.S. Ford also offers an all-electric Mustang Mach-E crossover that features similar design cues and badging to the two-door coupe, but it shares little to no other characteristics other than the name. I can understand the green movement, but we're so proud of our V8s, Morentik said, adding the model accounts for a majority of Mustang sales in Europe. It helps define who Ford is outside of the United States. The 7th-generation Mustang, which Ford revealed in September, recently started shipping outside of North America. It will eventually be sold in 85 markets on every continent aside from Antarctica, according to Ford. Non-U.S. sales have assisted in keeping the Mustang, which is exclusively produced at a plant in metropolitan Detroit, in production amid declining domestic demand for two-door sports cars. U.S. sales of the Mustang have declined from a recent peak of more than 122,000 units in 2015 to fewer than 49,000 last year. Internationally, Ford reports there have been more than 235,000 Mustangs registered since 2015. That's when the automaker began producing right-hand drive models for countries such as the United Kingdom, Australia, and Japan. The top markets for Mustang outside of the U.S. are Canada, Australia, and Europe, according to Ford. People relate extremely strongly to Mustang, Morentik said. The pull is amazing. Morentik declined to discuss future product plans for the Ford Mustang, including a hybrid that was reportedly cancelled for the 7th-generation car or the potential for an all-electric version of the two-door vehicle. Thank you for watching SNN Primetime News, your trusted source for the latest updates and stories from around the globe. Until then, have a great night. Thank you for watching SNN Primetime News.